So this lovely young lady had 2 prior surgeries. The first was at a hospital plastic surgery clinic, and it was revised 2 years later. It's now been a number of years. Her primary concern is she has difficulty breathing. She's narrow in the internal valve, which is the middle part of the nose. Also, that narrowing creates what's called an inverted V deformity. The shadow here not only looks bad, also causes breathing issues. The tip actually is, she feels it looks too round because the tip actually is shaped this way, also in a V fashion. Instead of being triangular this way, it's opposite. These deep creases make the tip look excess round. Also, the highlight is too high, called the tip defining point. From the side, you can see she has a nice profile, slight excess in this area. Just a little bit too much Caimella show. The distance from here to here is a little bit excess. On a 3/4 view, you can see the rounded tip. That highlight, again, too high. We want the highlight a little bit lower to create a triangular tip. From below, you can actually see this is the point of the tip cartilages curving into the nose. It may have been the nose cartilages have been over tightened, or they fell in. They need to be supported. Will create more of a natural crease. Also, a poorly closed scar. We're going to cut out the scar and create a scar that's barely visible. Much neater on that will both help the internal valve and improve that step off, both functional and cosmetic, on both sides. We want to support the tip cartilages and then create a more triangular tip. So we want to efface this deep crease, create more of a shape, either by reshaping the cartilages or possibly with a cartilage graft. Also, just a gentle rasping of these corners of the bones here. So this is some type of tip graft that was sutured over the tip. This is the dome on the right side. The one on the left, this left one had obviously fractured prior, and this is where the domes meet in the middle. We have to dissect this all out and see what's underneath it. You can see from the bottom that this is curled this way. It's also causing twisting of the tip. take this off. It's probably a shield graft that's went awry. Probably from one of the lateral screws, so thin and soft that it was sitting pushing the tip. Dividing our tip cartilages in the middle. And this is why I always like a columella strut. So what happens, you always get some twisting of the medial curve from asymmetrical scarring. So, and even if it's a straight nose, I always put a columella strut in open rhinoplasty. Because you're destroying all these attachments, and when you put them back together, you may get some scar contracture in an abnormal angle. You can see how this one is curved this way, this one's curved that way. Silks, please. Just got 5 millimeters of cartilage here. That's not enough to support the tip of the nose. Definitely need at least 7 to 8 millimeters, unless some of them very strong cartilages. And darker skinned patients rarely they have strong cartilage. Here's our caudal septum right here. So now we dissect our septum out. Woodson. There it is. That's the plane, right under the perichondrium. Freer. Converse scissor. Medium speculum. Freer. So it looks like we have a virgin septum, which is good, and there's plenty of cartilage for grafting. Single hook. Place it right there. 15 blade. So we have our septum nicely isolated. You see it's fully intact, which means we've got plenty of cartilage for grafting. So we don't have to use our ear cartilage. She's got a little super-tooth fullness we want to get rid of. Now I think the super-tooth fullness is not cartilage. It's this, I think it's this schmutz over here. So I'll take a Converse scissor. This is all soft tissue. So since we're not doing any hump removal, we can just go ahead and harvest our septal cartilage. So take a cent. So I need a decent strut here. All the way back. Medium speculum. Okay. So separated superiorly. This is posterior. And then off the maxillary crest. This is what we got for grafting.
Piece of cartilage.
Yeah. A little crooked behind here, so we'll take care of that. Bone scissor. Grabber. Gentle, free form grasp. Mark on the septum, and I'm going to go down to the end, so mark on the stick. I'm going to taper so it slips right up under the nasal bone. Okay, I'll take the brown, add some harpoon, please. Slip this right up to the edge of the nasal bones. Go a millimeter below so we can elevate our middle vault over it. Through. Good. Another one. Doesn't excessively widen our middle vault.
Right nose when you do a